Okay, we're here live. It's working.
Um,
So that's perfect. Okay, so welcome everybody to Her Stories Untold Live Talks with Traei today. And my name is Traei. I am the founder and author of Her Stories Untold. It's a global book project sharing different empowering, inspiring stories of women around the globe from all walks of life. The reason that this project was created was because I realize that there are so many women out there that have stories to share, journeys that have been taken, but not realizing their significance and importance. This project, Her Stories Untold, is open to all women in the globe, also transgender women as well. So if you have a story of your journey of how you came to be, whom you are, and where you are today, please do visit www.herstoryuntold.com. Again, the purpose of this global book project is to inspire, empower, uplift other women from all walks of life from all over the globe. Now, before we begin our talk today, I want to acknowledge that the land on which I live and work is the traditional and unceded territory of the Kwikwetlem Nation and lies within the shared traditional territories of the Tsleil-Waututh, Katsiamaskin, Squamish, Kikit, and Stolo First Nations. Very importantly, I want to warmly welcome everyone for joining us here today, and as well as Dr. Jimmy Chan, so that we can talk about what does a dentist have to do with breastfeeding. Welcome, Dr. Jimmy Chan.
Hi, Traei. Thanks for having me today.
No, thank you. Thank you so much for joining. Appreciate your time. So, Jimmy, tell us about yourself. Who are you?
Well, I'm a dentist. I've been practicing for about 25 years out in North Vancouver in Lynn Valley area, and yeah, I graduated from the University of British Columbia from Faculty of Dentistry, and yeah, it's been a blast. It's something that I really enjoy doing. I've wanted to be a dentist since I was 12, so it's quite something that I'm able to do what I love doing. And yeah, I mean, certainly there's lots of interesting things that one can explore when it comes to each of our professions. And for me, being able to help breastfeeding dyads, babies and moms, and also the dads as well, is really close and near and dear to my heart.
So yeah, that's very important. So I just, just wanting to share with everybody, Dr. Jimmy Chan is the co-founder and current board member of the ICAP, International Consortium of Oral. Okay, you're gonna have to fill in ankylofrenula.
That's right.
Did I say it right? Okay,
That's
professionals, right, yeah. And a past board member of the IATP, which stands for International Affiliation of Tongue-Tied Professionals. And Dr. Jimmy Chan is an active member of the Academy of Breastfeeding Medicine, American Academy of oh my God, I cannot say this. Yeah, Odontology, Academy of Laser Dentistry, Chinese Canadian Dental Society of British Columbia, and Canadian Dental Association. So that's amazing. So now Dr. Chan, you were mentioning that you wanted to be a dentist since that when you were 12 years old, right? So what was that what was the exact precise moment, I guess, when you decided that, hey, I'm going to be a dentist?
Well, first of all, please call me Jimmy, since
Jimmy. Yeah, I was like, thank you. Yeah.
We're not in my office at this point in time. But
yeah,
anyways,
you got your nice fireplace going on. Is that a real fireplace?
It's a real fireplace. Yeah.
Awesome. I love it. I love it.
So yeah, I went to the dentist for almost like the very first time when I was quite old, I guess, when I was 12, and that's probably because my parents didn't have dental insurance up until that point in time, and so quite often having dental issues would be sort of home remedies. If you have a wiggly baby tooth, and dad would go and just tie some dental floss and just get you to start pulling and yanking away, and that was uncomfortable, obviously, when you're doing stuff like that at home. So when I was 12, I went to the dentist to have a baby tooth removed. And I was just absolutely flabbergasted and fascinated that he was able to do it without having any pain, because he gave me some local anesthetic. So from that point on, I was really keen to do what that dentist was able to do. And but yet, because my grades weren't that great, they were kind of average, I was thinking, oh, maybe there are other sort of options that are available, because I kind of figured, dentistry required some really, really smart people to be applying for. And so, yeah, I was thinking of pharmacy, optometry, other sort of options in the healthcare. So that's what I want to do. I want to help people. And then, yeah, I got into science in my first year of university, British Columbia. And then in my second year, I got accepted into the Faculty of Pharmaceutical Sciences, so pharmacy. And that was a great opportunity, because it gave me an excellent background in pharmacology and basically learning about drugs and interacting with patients, because I was able to role play with certain situations at school, and also work part-time as a pharmacy assistant. Then I guess what happened was, after 2 years of pharmacy and 1 year of science, I was accepted into the Faculty of Dentistry in my fourth year. So I think I was pretty young at that point in time. I think I was like the second youngest in my class.
Wow.
And it was a 4-year program. So yeah, it was something I really wanted to do, and I finally got a chance to do it. So I graduated. I think I was 24 when I graduated from dentistry, and then I associated for about a year in my in a dental practice out in Maple Ridge, which I realized that I think I wanted to run my own show, and I bought an existing practice in North Vancouver from a retiring dentist. So being a dentist and running your own practice, two different things, because one's business and one's clinical, right? And so it wasn't a group practice. I didn't have any other partners, which is quite often right now. We have a lot of corporate dental practices that are owned by companies. But yeah, I've been pretty much running my own practice as a solo dentist for about 24, 25 years. And it's a huge learning experience when you have to do things on your own. They really teach you a lot about, things like business and finances and dental science. You had to learn everything on your own. So lots of mistakes made, lots of things that you can't really learn until you make those mistakes. So it was a good
100%. I just think that I think it's actually quite amazing to be able to do all that. And I think it's a very, I don't know what's the right, it's like a wholesome experience, right? You know exactly what's going on in front, behind the scenes, the whole entire operation. I think it's so important. And so it's great to have. And sorry, I just want to backtrack a little bit, because you mentioned, back then being little, I know, like, when I think of dentists, they're always really good people, but I myself, I'm always kind of afraid to go to the dentist because I'm just I don't have very high pain tolerance and whatnot kind of thing. But I remember when I was young, I would hear like grandparents talk about how if there was a loose tooth or something, and they'd tie a string to it or something. And they said that, oh yeah, just tie it to the door handle, right? And then you slam the door, and that's when the tooth falls out. Don't do this, okay? Do not do this. Do not try.
Hurts.
Yeah.
Been there, done that.
So it's interesting how your teeth, they're so important. I think you were going on about your dental practice before I kind of jumped in. Yeah, so you want to continue?
So really what happened was that, as someone who's new in the profession, in dentistry, and really, again, any profession, I really quickly realized that, whatever I learned in school wasn't enough to basically practice dentistry in the real world. So, that's where I thought about my, lifelong journey of learning, because, there's just so much out there. And then when you talk to other dentists, they're like, wow, how did you learn about this? And, wow, how did you get so proficient at that? So obviously a lot of continued education, which is a requirement for us to maintain our licenses to practice in BC and Canada. But yeah, I mean, I guess I started to become quite a continued education junkie, and basically took a lot of courses and classes, had a lot of conferences. So there's many things you can learn about dentistry and improve on. A lot of people are, into aesthetics, so things like veneers and bleaching, smile
What are
design.
veneers?
Veneers
Yeah,
are the
I
well,
know.
if you ever seen Tom Cruise smile, he's got all the white teeth there, and that's a lot of it's going to be a veneer. So basically porcelain facings that are glued onto your teeth. That's what veneers are. It could be porcelain, it could be composite, but it makes your teeth whiter, and it changes the shape and size of your teeth as you prefer. So
Okay.
those are cosmetic types of enhancements that dentists can provide.
How long does it take to, I guess, glue the veneers on? Like if you're replacing do you replace your entire tooth set or something?
No, just outside. Just outside. Veneers tend to be just on the outside. If you have a crown, that's if you put it over the entire tooth.
Yeah.
And that's basically half of double the veneer, because veneer is on the outside. The crown is on the outside and on the inside. So yeah, the crown or cap. But it can accomplish the same thing. It changes the color and the shape and size of your teeth there. So for some people, they have like the front 6 or front 8 or front 10 of their upper teeth veneered, and so therefore, wow, you look like a Hollywood movie star. Yes. Do you have veneers, Traei?
No, I don't have veneers yet. I just have these bigger teeth.
They look great. You have really
Okay,
white
well,
teeth.
thank you. Yeah. Yeah.
So the point is that
just so that everybody know, no, Dr. Jimmy Chan is not my dentist. So yeah, so we're just on the topic of dentistry. I'm sure. Yeah. Yeah.
so other things such as Botox, right? That's also
Oh,
a
Botox.
cosmetic.
Okay, that's
So
interesting. Yeah,
a lot of
never done that.
dentists offer Botox in their practices now, again, for aesthetics. So not necessarily just the teeth, but on the facial aspect of things. Invisalign, which is very popular and very, very common. People having their teeth moved without braces, using clear aligners. Implants, which is another popular thing for replacing missing teeth. Full mouth reconstruction, if you've worn down your teeth by clenching and grinding, or you had some sort of a trauma, then yeah, people can
for the
provide that.
grinding, if we can talk a little bit about that, because I know I know quite a few people that grind in their sleep, because they'll tell me about it, or maybe their significant others will tell me about it. But yeah, essentially I think it has a lot to do with like is it stress?
It's multifactorial. Quite often it can be, but you have kids, like they're literally 5 or 6 years old, and they're grinding their teeth that's in their sleep. So I mean, how much stress can a little 5-year-old have? It's something that it's not that well known. We have some people that are concerned that people clench or grind their teeth if they are oxygen challenged. So if they're not breathing well, if they have sleep apnea, if they snore, if there's some sort of nasal obstruction or sinus obstruction, it's just the body's way of addressing some sort of stress in that sense. Because if you're not taking enough oxygen, you're clenching. Yeah, you potentially might be doing that. And so there's a new field, I guess, a newish field in dentistry known as airway and sleep dentistry. So whereby you evaluate how much oxygen intake you get, and you do CT scans basically to see how much airway volume you have, and you can do sort of before and after sort of comparisons. For instance, if you were to do some sort of a surgical procedure or use certain devices that might enlarge your airways. So yeah, that's fascinating stuff that that starts to merge into medicine to a certain degree,
Yeah.
because when it comes to sleep apnea, you have medical doctors
Yeah.
that assess that properly. So
That's interesting, because I think this is obviously related to snoring or something, right? Because you reduce oxygen intake, right, for various of different reasons and so on. Yeah, so I actually didn't know there was that realm of dentistry. So that's that's very, very interesting. Yeah. So you're going. I'm just gonna go plug in my charger because I feel like this laptop is just gonna die out on me. So excuse me, and the
sure.
realities of life, technical fail. Please bear with me. There we go. I think I should be good. Back again. Okay. So please continue.
Yes, I guess with regards to all that, I mean, these aren't things that they teach us in dental school. So you have
Yeah.
to pretty much learn it on your own. They're not going to teach you about Botox or airway dentistry, or even necessarily Invisalign or implants. So yeah, basically, the world's your oyster when it comes to learning what you want to learn, to see what can be helpful for your patients. So I developed an interest in dental lasers. So
Dental lasers?
yeah, laser dentistry. I was always
Okay, please tell me more, because I'm here. I mean, read the terms here and there, but what is laser dentistry? I'm still fixing my thing. Okay. So yeah, we are currently live back on again, and I do sincerely apologize to everybody that's watching, and to Jimmy here as well. I'm not sure what happened, but apparently my laptop pretty much just wasn't charging, so I'm at a different laptop now. So we're gonna continue this amazing talk once again. So yeah, welcome back, Jimmy.
glad to be back.
Yeah. So just so I guess for the audience that that are just retuning in again, so we were talking about Jimmy's I guess journey as a dentist and how he became whom he is, and what were we talking about? We were exploring the topic of something along the lines. If you want to fill in the gaps.
Laser dentistry.
That's right, laser dentistry. And then you're about to explain, and then I was like, oh my God, this isn't charging. So let's go from there.
So basically, laser dentistry is when you utilize lasers for doing tasks in dentistry that perhaps you might have used other types of tools and equipment, or to perform things that you weren't able to perform before.
Okay.
So I'm a movie fan. I've always been a fan of sci-fi movies where lasers were portrayed as high-tech tools and things of that nature. Superman would have laser beams coming out of his eyes, and I thought that was kind of cool.
Yeah.
So yeah, when I realized that, hey, we have lasers, and lasers have been around for a long time, in many different aspects of life. I mean, you go to your supermarket check stand, and you're scanning something, that's a laser, right? That's being used. CDs, DVDs, that's all lasers. And interestingly, the man who invented the laser, he lived in Vancouver for the longest time, and I even had a chance to meet him. His name is Theodore Maiman. And so yeah, we have a local sort of connection to lasers that are basically ubiquitous in the world. But for dentistry, lasers can be used for lots of interesting things, for hard and soft tissue purposes. So when I realized that, okay, let's get going. Let's try to figure out how lasers can be applied to my dental practice. I went and took the proper training. I took the courses. I went to the conferences and got the appropriate certification, which is going to be very important, because a laser that's not used properly can be, unfortunately, dangerous. You don't want to shine lasers into your eyes, just like you don't want to shine a laser pointer up into the sky, because it might hit the eye of a pilot flying across the air. So anyways, the point was that there's so many different things you can use with lasers, such as using it for biopsies. You can, treat gum disease. You can, help, perform root canals and treat canker sores and cold sores. We can use it for biostimulation or photobiomodulation, which basically is a non-contact sort of way. It's quite often used in sports medicine and physiotherapy.
Okay.
And in massage therapy when it comes to healing of soft tissues and muscles and fascia, with the benefit of laser energy. And so I've acquired, all different lasers over the course of over the years. And about 12 years ago, at a conference run by the Academy of Laser Dentistry, which I'm a member of, I listened to a lecture by a pediatric dentist.
Okay.
He's from Albany, New York, so he's American. And he was encouraging us to use our dental lasers to help babies nurse better. And I thought, well, this is interesting. But yet at the same time, I'm not a pediatric dentist. I don't see a lot of, kids, let alone, or babies in my practice. And his name is Dr. Larry Kotlow. And he was one of the first dentists, I think, probably in the world to use lasers for this purpose. It was an interesting idea, but as I said, I didn't know if I could, accommodate newborns and infants in my practice, because again, I wasn't geared, my practice wasn't geared specifically towards children. And I'm not a pediatric dental specialist. But Dr. Kotlow, who I'm really honored now to call my mentor and friend, was insistent that I could do it, and he started to refer patients to me all the way from Albany, New York, because he fielded calls from all over North America for his services, which he wasn't able to always accommodate because he's in one part of the world and someone else is in another part.
Were you one of the first? I'm not too familiar with how many, like the first basically in Canada, or?
No, I don't think I was the first, but
BC?
BC, I think, probably. I never sort of compared notes with other people, but I think I've been doing this for about 10 years.
Wow.
So yeah, it's so fast forward 10 years, later, I'm treating babies in my practice on a daily basis. I mean, certainly this wasn't something they taught us in dental school, so we really needed to, learn this on our own. But yeah, basically, Dr. Kotlow was the person that
Was your mentor?
He's the one I give credit to, allowing me to do what I do, and to help the people in our community here in Vancouver.
No, that sounds amazing. I didn't, like, when I hear laser dentistry, I'm thinking mostly like cosmetics. I didn't think there was, obviously because I'm not trained in the medical field, I'm not too aware of what that captures. So I think that's amazing that these services are being offered, not just to adults, but treating babies, and which leads us into my next question. The reason I guess we're here today, a big chunk of it is like, I'm very interested in your cause that, in regards to, dentistry, we're now understanding the background, the history, and then, how it's, it got linked together with, the very cause that you really care about, with the ICAP, right? If you want to share a little bit about that.
Sure. Yeah. So, I mean, I'm pretty much, a general dentist, family dental practice, and never was really involved in any type of politics or organizations other than the ones that I belong to. So I believe, again, probably about 9 years ago, 8 years ago, I mean, I went and attended a conference at one of these ankylofrenula or tongue tie professional conferences, and I guess they recruited me to be part of their board of directors. And so from that point on, I got a little more interested in terms of how we can help to promote knowledge and understanding and awareness of this issue, whereby we have this little bit of tissue that's underneath our tongue and our lips that potentially can cause a lot of problems. So
What
Yeah.
exactly is a tongue tie? That's, I think, yeah,
Yeah,
that's a
so
burning
that's
question.
that's the million dollar question, and there's a lot of different definitions of tongue tie, and essentially, it's when you have that bit of tissue underneath your tongue that that can possibly impede function. So that's in a nutshell. So I mean, we all have that little bit of tissue. If you take a look underneath your tongue, you lift it up and check it out in the mirror. We all have that little bit of tissue, depending on the individual. It can be attached, really close to the tip of the tongue or a little further back. But to me, what makes it easier for everyone to understand is that yes, we all have these tongue ties. We all have these little bit of these tissues that attach the tongue to the floor of the mouth, and also lip ties. Lip ties is a term that Dr. Kotlow had coined, which is essentially the tissue that attaches the lip to the gum line. So these are normal anatomical midline structures that we have in every single human being.
Yeah.
And for the most part, it doesn't really cause any problems. I mean, babies can feed, they latch, they can bottle feed if needed. It doesn't cause any feeding issues. It usually doesn't cause any speech impediments, issues with eating of solids and liquids. When it comes to it, so as they grow up, usually doesn't cause too many other issues, including, as I say, speech and also orthodontic and dental issues. It's when they do cause problems,
What
that's
happens?
when we have, the appropriate people to assess what these issues are. So if we have breastfeeding issues, we have lactation consultants. If we have speech impediments, we have the speech language pathologists that can help address these issues. If we have issues with eating of solids and liquids, and we have the feeding teams in the hospitals that can help with that. And usually it's occupational therapists,
Right.
physiotherapists, speech therapists, and pediatricians and nurses.
So I guess no, thank you for explaining that in detail. And I guess in simple terms, if there is a tongue tie issue, you're gonna have trouble, I guess, tasting, swallowing, right?
Not necessarily.
Not necessarily. Okay.
Again, it's a whole range, right?
Yeah.
So you can have some very mild symptoms,
Yeah.
and then you can have symptoms that are quite drastic, where it's limiting your ability to gain calories and gain weight. So
Yeah.
that's where it's really critical. If we have a baby that has failure to thrive issues, then usually the pediatricians and midwives and the doctors are going to be very concerned about that, and the lactation consultants. So yeah, it runs the gamut in terms of the severity of how tongue ties and lip ties can affect normal function.
Okay. So it seems like it's not like a one definite, like if you have tongue tied, this is exactly what happens. It could be multitude of things that each baby is experiencing, right? Each person is experiencing, right? So,
Mhm.
and okay. Wow. Um, so I guess what I'm interested in is what can be done. Like,
Well, first of all, what's important is that, and again, I'll speak into the context of the infants and the newborns and the babies that I see on a regular basis, is that they should be seeking out the advice and assistance of a qualified and knowledgeable lactation consultant. So lactation consultants, there are actually many women and mothers and families don't really know who they are and what their roles are, which is unfortunate because they're truly, literally the specialists when it comes to breastfeeding. And
okay.
quite often they know quite a lot about bottle feeding as well, if that's the desire. And so their proper designation is International Board Certified Lactation Consultant, so IBCLC. So if someone has an IBCLC letters after their name, then this is someone who's qualified and being able to, after rigorous testing and many hours, hundreds of hours of observation and clinical training, to be able to be considered a lactation consultant,
Hmm.
which is different than a lactation counselor or a lactation, helper. Or again, there's there are other types of, easier, I guess less qualification types of programs that are out there, but IBCLCs are the ones that I would normally, consider as the specialists or the experts for breastfeeding. So really, many times that's all that's required, is to seek out the help of a knowledgeable lactation consultant, and many of these breastfeeding issues can be resolved.
Right.
So, is it a tongue tie that's resulted in those problems? Well, maybe not. But if we have conservative, non-surgical efforts, methods to go and improve breastfeeding, then yeah, is there really need to do any surgery? The answer to me is no, right? So it's only when we do see issues, despite the efforts of the lactation consultants, or we see limited improvements, that's when we have people like myself who can help to evaluate the anatomical restrictions related to breastfeeding. Yeah.
So I guess what I'm hearing is that the lactation consultant, most people aren't too aware of that, and
yeah,
accessing it, especially if you're not breastfeeding, right? You're not lactating, right? So you're not going to be exposed into that realm. But yeah, sorry, you were about to comment on something.
The best place for lactation consultants to be positioned is in the hospitals, in the maternity wards, right? So
yeah,
you'd think that that's where you would have all the lactation consultants be available, at your disposal to help and assist and to facilitate and support new mothers and even expectant mothers, to be able to give them information beforehand. There's all this discussion about prenatal classes that that women take to prepare for the birth of their child. And quite often they're nurses. They're obviously knowledgeable as well, but the lactation consultants again are truly the best people to help with that. And we don't have a lot of them in the hospitals. They're not employed very much. Quite often, if they are, they're also wearing another hat, which is being a registered nurse. And sometimes you're not necessarily going to be able to wear both hats, as a nurse in a maternity ward or the NICU unit, as well as having your lactation consulting hat as well. So yeah, that's something I'd like to be able to see change, because for a lot of women, breastfeeding is very important. I think the pendulum has swung back away from bottle feeding with formula or pumping. There's a desire for a lot of women to be able to breastfeed because there's lots of benefits to breastfeeding.
I think
discussion earlier.
Yeah, on the topic of breastfeeding, this is very interesting, very important part. And I think most people don't really go into it or become aware of it, as I mentioned earlier, unless they're, in that journey or process of breastfeeding, right? So I know like breastfeeding itself, like there's been research done where like if a baby does, is breastfed versus babies that, just grow up on formulas and never having been breastfed before, kind of thing, right? The psychology behind that, the relationship that are developed later on in life between the child and the mother and adult and so forth, right? I think that's a whole new realm to that, and most people don't really look too deep into it unless you're going to experience or experiencing it, right? So yeah, I don't know if you want to share about some of the about the thoughts on in terms of like the psychology, like breastfeeding or formula, right? So
well, I mean, what's obviously going to be very important is that your baby is fed. So if you're able to breastfeed, that's great. I mean, it provides so many benefits to your child. Be able to breastfeed. If you can't, then you can potentially also bottle feed. Ideally with pump breast milk. If not, then with formula. But I mean, as you're saying, in terms of psychologically, I mean, it builds a special bond. The closeness and comfort of breastfeeding helps you bond with your baby. It's one of the many things you can do to build a secure and loving relationship with your child. And cuddling your baby, on the breast, the skin to skin, as lactation consultants call it, can help your baby be more trusting and confident as they get older. But yeah, I mean, so many benefits when it comes to breastfeeding. I mean, there's research that shows that children that are breastfed score higher on IQ tests, right? They may stay in school longer, or more money, as adults. There's just lots of different benefits that, really, when you think about it, breast milk is free. There's no cost to it. Whereas, formula,
unless you're buying breast milk. This is interesting now because I know people that gave birth and they weren't able to produce enough breast milk themselves, unfortunately. I think there are, this crosses a little bit into herbology now. Like, there are herbal supplements that have been shown or proven to help, induce like more milk production, right, in the glands, so to speak, right? So they'll try for that. If that doesn't help, then they're buying breast milk from, I guess, what would you call the lactation?
No, well, what I understand, again, this is not my forte, but with all the families that I get a chance to meet, I mean, there's donor breast milk, right?
Yes.
So there's milk banks, there's breast milk banks
Milk
that are
banks,
hospitals, right? And so if you have, for some reason, insufficient glandular tissue, IGT, which is where you just don't have the capacity to physically produce enough milk, then you can reach out to these hospital breast milk donor banks. And again, I don't think there's any cost. I don't think there's a need to purchase it. I mean, in the free market, if you were to go look for breast milk on Facebook and someone responds and wants to offer it for sale, that's fine. But I don't think that there's a
just buy random breast milk of it.
I don't know if that's such a great idea personally, because when they do have the donor breast milk that's available to you, that's offered to you from the hospitals, it's been screened. It's just like blood, right? You don't want to basically just get a blood transfusion from someone who donated the blood without having it properly screened. So same goes with the donor breast milk. So I don't think there's a cost to it, and it's maybe just registering yourself into the system. Because some women have lots of excess breast milk and they're happy to donate it for others that can't produce as much or can't breastfeed at all.
This is interesting because now I'm thinking, like, does a woman's breast size have to do with how much milk they can produce? Or no, I don't think there's any correlation to it, right?
Not necessarily. I mean, you can have small breasts and produce lots of milk, and vice versa, or alternatively, less breast milk even if you have large breasts. And then, of course, there's the discussion of breast implants and how that also, affects breastfeeding as well. But ultimately, that's not my expertise.
No, it's just out of curiosity we're on this topic, right? Because then I'm also thinking about transgender women, right? When they go through their surgery process to changing to a woman, and then they have breast implants, right? And I've read somewhere too as well that when they also are curious about motherhood, they want to be mothers, right? So, and then how that goes about. I mean, that's a whole nother talk, I'm pretty sure. But,
chest feeding is another term that's used.
What's it called?
Chest feeding.
Chest feeding?
Yes.
Just like CHEST?
Yeah.
Chest feeding? Okay, yeah. So what is chest feeding?
Yeah, not something that I'm familiar with, but if you're talking about, people who mothers that want to nurse, and it's just not something that they were born naturally able to do, then and things like chest feeding is, and that's where you have the lactation consultants. They're the ones that can help to provide the guidance for this. And that's why it's so important that people realize that, okay, I mean, they might have had midwives or their their OBGYNs to help with delivery of their babies, but once it comes to feeding their baby, their child, they're no longer the specialists. They're no longer the ones that are experts. They might know. I mean, even pediatricians, for as much as they know about babies and infants, they're still not the experts when it comes to breastfeeding. It's the IBCLCs that are. So I can't help but continue to stress and underscore the importance of lactation consultants when it comes to helping mothers that are having problems with breastfeeding. Because it's quite often not the first resource, the first people that they think about, because they haven't been taught that there is a resource like that. The lactation consultants that are available. It is possible that we might have, depending on where you live, that there are fewer certified or board certified lactation consultants. In some areas in the world, there are lots of them. I know, many places in the U.S.
Not here though, in BC.
No, we have a fair bit. I think we're quite blessed to have a number of lactation consultants that I personally collaborate with and have good rapport with. And so we certainly do in the Lower Mainland here in Vancouver and even BC. We do have a number of lactation consultants. But here's the other thing is that their services aren't always going to be covered by our healthcare system.
Well, okay.
So
that's very important because a lot of things aren't covered in our healthcare system at this rate now. There's been a lot of changes, especially during the pandemic times, right, to our whole entire healthcare system.
Now we do have a number of registered midwives who are also board certified lactation consultants. So ultimately, in the first 6 weeks of life, if you choose to have the midwives, help care for you and your child, then you can potentially also have the benefits of their lactation consulting expertise. And so that can be very helpful, for at least for the first 6 weeks to get you going to be more proficient and about breastfeeding your child. But then not every mother, every woman goes that route to have a midwife to help deliver.
True. Yeah.
So sometimes it's then you have to seek out breastfeeding clinics and centers, which we do have a number of them as well. And so that's where you can connect with them. But that's again, not a lot of women necessarily know to go to those places. So that's really part of why I wanted to be here today. It was to raise awareness that hey, we have resources, and we need to be able to let all the women who are thinking of having babies know that these resources are available and should be referred to as often as possible.
So I guess this leads into my next question. Jimmy, can you tell us, when did you decide that this was important and you wanted to make a change?
Oh, okay. Well, as I said, it was at that conference that I had attended, and I connected with Dr. Larry Kotlow.
I think that was that precise moment that kind of just,
I just figured, hey, you know what? I have this tool. I have these tools. I have multiple lasers in my practice. I'm like, hey, this is something that I've done on other older individuals, like children, adults who they referred to me because they needed to have, say for instance, a lip tie released in order to close the gap between their teeth, because just orthodontics wasn't, braces wasn't really allowed for that to happen. Or we had kids and adults that had lisps and speech impediments, and tongue tie releases were indicated or suggested by their speech language pathologists. So I'm like, I'm already doing these procedures, and I'm doing it for older people, so why not consider doing it for babies? So I mean, it made sense. It was a natural progression, and Dr. Kotlow gave me the impression that there was a demand for these types of services. So it wasn't like I went and advertised it, and really, in fact, it was Dr. Kotlow that referred me my first cases, because I believe there was a midwife out in the Comox Valley in Vancouver Island, near Courtney. She, I think, connected with Dr. Kotlow, to, find out, well, who would you recommend out here? And Dr. Cullo gave her my name. And so here we have this midwife who I've never met before, started referring lots of families over.
Wow.
And they had to travel quite a distance, right? Because
Yeah.
we're not talking about just, a ferry ride over.
Yeah.
We're talking about, a huge car ride in order to get to the ferry, and then a ferry ride, and then the car ride over to my practice. So there were, women that were traveling, 5-6 hours just to attend, and they had to basically drive and take the ferry back because it was a day trip with their newborn infant, right, who was having these problems. So I'm very grateful to have these midwives that referred to me from a distance, and we were able to.
We're grateful for you too, Jimmy, for caring about these causes, right? Something that came to mind is that I think there's mental health issues that are associated with breastfeeding, right? Especially with the tongue tie, and then having those experiences and the lack of awareness or information of where to go to, right? So I don't know if you want to share like a glimpse of that.
Well, I mean, there's the concern about postpartum depression, and again, that's a whole different of wax, because that's that can be triggered by lots of different things. But one is not being able to feel confident or comfortable with breastfeeding. Women can have difficulty with nursing, right? I mean, they can have inadequate milk supply, and be made to feel inadequate or not be able to provide for their child. Sometimes this is pressure and anxiety that's self-imposed. Other times, you have other peers that like, oh, I'm going to breastfeed just fine, and what's wrong with you? And hopefully, we don't have other women that make those comments. But interestingly, I have heard of doctors and pediatricians and even other breastfeeding sort of advocates that have said some harmful things to women. I'm scratching my head. It's like, no, we want to be supporting women. We want to be supporting their efforts to try to do this. And so, I mean, lots of different I think concerns about that.
I mean, at that stage, it's definitely very vulnerable for women, because you're like, I mean, I don't have children myself, but I've seen people, talk to people, and I think you're, as a human, you're born into this world, discovering you're becoming a girl, right? Learning how to be a girl, and then you grow into like womanhood, and then you come into the stage of becoming a mother, having a child, growing inside you, right? And then coming to deliver that baby, right? Whether by natural birth or cesarean section, whatnot kind of thing. All those experiences are new, and certainly is like the division between the next chapter of a woman's life kind of thing, becoming a mother, right? No longer just a girl or a woman, you're now also a mother, right? And then you want to feel adequate to be able to provide for your child, because biologically that is what, innately that's what one will want to do for their child, right? Even in the wild, with animals and mammals and whatnot kind of thing. But being not able to produce breast milk, and alongside with, as you mentioned, like postpartum depression, right? So it happens quite, I think, more often than people speak about, or perhaps because of lack of awareness or attention into it. It's sometimes you have to be very sensitive to get in tune to say that this person is kind of going through these type of things, right? So, and I think it has an impact in terms of like, if I'm gonna feel bad, like if I can't breastfeed my baby, I have to get someone else to give their milk to my baby, because I'm not able to produce, but I'm supposed to be the mother of the child, right? So I think that's a very heartbreaking situation, because I don't know, maybe because I haven't dove right into this realm of things. I feel like is there counseling for women in regards to yeah, you can't.
Absolutely. Yeah,
Yeah.
absolutely. No, there are hotlines, for women. I mean, some of them are 24 hours, others are, basically they're all manned by volunteers, for women who have postpartum depression. And so, most definitely, if any woman who is feeling like they're having these issues, to reach out just to these hotlines, to deal with postpartum depression, not just about breastfeeding, but everything else. Because there's hormones that are coursing through your body when you're pregnant, and when you're postpartum, that can really make things all wonky, for women, in the sense that their feelings are not necessarily how they would be, if they weren't with child, right? So
Yeah.
I think it's just important to make sure we encourage women to reach out and find people that they can talk to and get support. I mean, the other mental health concern is when your child is possibly breastfeeding or trying to breastfeed and causing a lot of pain, right? So when think about it, when you have pain, wow, okay, you're trying to feed your child, but the child's causing you so much pain that you don't want to be feeding your child because it hurts, right?
Yeah.
So that's where it's like, ooh, okay,
You can develop rashes too, I think, from
I mean, listen, you can have nipples being shredded, torn, ripped off. I mean, it can be really, really very traumatic, but even infection and that sort of thing. But more importantly is that the pain, right? You don't want to be continuing doing something that causes you pain on an ongoing regular basis, because your child's feeding 5 to 7 times a day.
Yeah.
Right. And you're breastfeeding 5 to 7 times a day.
6 months to a year, right?
Well, yeah, ideally. Yeah. I mean, how long can you sustain that? That is a lot of mental angst and anguish and stress, right?
Physical.
Yet I know of many women that do it because they've been told, just expect to have it, hurt, and that's normal, and just grin and bear it. And there are women that do this for 2 years, 3 years, and all throughout that period of time, they're in lots of pain, and they've just been told that that's just how it is. So, tough it up, suck it up. And like, wow, that's, I don't think there were many men that would be, willing to endure that much. But there are lots and lots of women that have, right, from all the
these unspoken
anecdotes.
pains.
Yeah. Well, this is where,
and interestingly, I think, culturally dependent too, right? Certain cultures you can, like here, we can sit here in our live talk openly discussing things, but I'm sure there are cultures around the world where you're not going to be able to have an open discussion about these topics and whatnot, kind of thing, right? So it's a very almost like a hush, closed door, like you don't want to show, right? And and that's the thing, like, crosses into like breastfeeding, the whole debate of like breastfeeding in the public, right? So, and then the frequency of that, the acceptance or the non-acceptance of that, right? It really varies where one is situated, in a global sense. Yeah.
I mean, there's still people that will shame women that breastfeed in public. And I mean, I just remember reading lots of articles, in the past growing up. It's like, oh, okay, feeding, your child, nursing them at the swimming pool, or, grocery store, or, in a shopping mall. And they were told to, basically cover up, you shouldn't be doing that. Like, I don't know. I don't think in this day and age we have that much that's being reported of those types of situations, thankfully, because I mean, you're trying to feed your child. I mean, that's really what it is, at the end of the day. But yeah, I mean, these are all things that women have to have had to deal with, associated with breastfeeding. That
All the challenges and the stress and the struggles that goes in between. And just in terms of breastfeeding publicly, I think that whole experience of how others feel about that when you see someone breastfeeding out in the public is, I think, very much socially conditioned and shaped by that individuals, perhaps like how they were brought up and what was their exposure, relationship, and how perhaps how their parents brought those perception of breastfeeding. It could also vary from in religion, a different aspect, culture. And then this is not to say one's better, than the other, or one's bad. It's just to say there's so many difference and variations of situational context, right? That has a huge impact of how a person grows up and perceive breastfeeding, right? And to come out to talk about it, the access of midwives and all that stuff. Yeah.
I mean, some of the most striking things I have heard is when women tell me that their doctor, their own family doctor, their pediatrician, their own family doctor, pediatrician, or OB/GYN, to tell these women that they weren't meant to breastfeed. That as a woman, you just can't breastfeed. You can stop trying. It wasn't meant to be, which I have always felt is one of the most heartbreaking things you can say to a woman who wants to breastfeed.
That is heartbreaking. I can only imagine, like, if I was to have a child, you naturally want to provide for your baby, right? And I think that's a difficult conversation to tell your patient, you're not meant to be a mother. You can't produce milk. There's something wrong with your glands. You're not able to provide for your child, right? Now, please go home and think. I'm not blaming the doctors, but I'm just saying that whole experience, right? It takes, that's a very, I don't know. It's very sad.
It's a heavy subject.
Yes. Yeah, it's a very heavy subject, definitely. Yeah.
So that's why, again, I when I hear these stories, these anecdotes that these families and these women, tell me, it's like, well, that just makes me feel more, wanting to try to help, right? Because
absolutely,
if there's something that I can do as a dentist, this is not necessarily, what we were taught to do, at all in dental school. But if there's something that I can offer, because it's within my expertise to perform these types of services and offer these services, then, hey, I'm happy to help. And it goes beyond teeth, really.
Yeah.
It is feeding, right? And that's why we're so. I think as dentists, we are in a very good position, and I think we're knowledgeable about the oral cavity and how that affects overall well-being. And so this is, to me, a natural extension of what I did learn in dental school.
Absolutely. I mean, in the medical realm, they're not divorced from one another, right? They're indirectly related, but I think overall everything's a foundation to something else, right? So, and I think that's so amazing that you were able to come across that and then expand further and explore and to focus on your cause, which is the International Consortium of Oral Ankylofrenula Professionals. Yeah, you're laughing there, right? Because that's
it's a mouthful, even for me.
Yeah.
I mean, if you count the number of letters that the acronym has, it's a mouthful. It's meaningful when it comes to we just call it ICAP in short.
ICAP?
Yeah, ICAP. Yeah. So International Consortium of Oral Ankylofrenula Professionals. So ankylofrenula. I think most people want to understand international. Consortium is basically an organization, right? Yeah. Oral is the mouth. Ankylofrenula. So ankylo, basically is tied, right? And frenula is like frenum, which is basically a tissue inside, Ankyloglossia. Glossia is the Latin term for the tongue. So that's a very common term that's been used in the past, is ankyloglossia. Most medical people will understand what that is. So, but ankylofrenula is not just the tongue and the tongue tie. Yeah. It's also other, oral tissues as well. such as the lip tie, as I said, the tissue that's underneath the front lip there, upper front lip. And now people are referring to ties that are along the side of the cheek as buccal ties as well. So another term for ankylofrenula or tongue tie, or basically these ties, is tethered oral tissues. So
Tether?
Tethered.
Okay.
Yeah, tethered, like they're tied down, tethered oral tissues.
Okay.
So that's another term that's used somewhat interchangeably with tongue tie and ankylofrenula. But we, I sit on the board of ICAP. I was instrumental in helping create the group back in 2016, and we wanted to have essentially a democratic organization for all healthcare professionals wanting to assess and understand and treat oral restrictions. So, I mean, we created the group, the organization, in response to a call for an ethical, inclusive, fair organization to represent the growing number of oral ankylofrenulal professionals in the world. So, we believe that mutual respect and collaboration amongst all the different health professionals, not just dentists, right?
Yeah.
Not just lactation consultants, but many different other types of healthcare providers that are working with oral restrictions. It's really important that we all connect and we're on the same page to furthering our knowledge and maximizing our successes in this field. So it's multidisciplinary, our group. We have many different, as I said, types of professionals that feel as strong as I do when it comes to collaborating, because alone we can't do it, right?
Yes, teamwork is the dream work.
I just provide the procedure. I mean, I do the releases, but before they come to see me, and I consider myself as the last resort, they should be seeing everyone else, right? To see if there's a way to improve things without the need for surgery. So it's very important.
Non-invasive.
Yes, exactly.
Possible.
So I always stress, and I keep stressing, because sometimes it sounds like it falls on deaf ears, that I'm the last resort. You need to do your due diligence before you come to see me, because it's if we can resolve things without surgery, on a little baby that's only a couple of weeks old, or even a couple of days old in some cases, then I think I would rather have that happen and not have to do surgery. So we have people who are lactation consultants that are part of this organization. That we have midwives, we have massage therapists, we have craniosacral therapists, and chiropractors. We have osteopathic practitioners. We have the SLPs, which are the speech therapists, speech language pathologists. We have the oral facial myofunctional therapists. We have the doctors, the pediatricians, the ear, nose, throat specialists.
Yes.
Which we are thankful to have count amongst our ranks. Obviously, the public health nurses, the occupational therapists, physiotherapists, sleep consultants, child psychologists, and of course the pediatric dentist. Lots of different people, doulas as well. That
the doulas,
are also important part of this whole community. And it's all about collaboration. That's our key term, is that we all need to collaborate. And that's why it's nice to be able to have people in our community, as well as in the worldwide international community, to be able to connect with and share information and knowledge, and also do the research, which is why it's so nice to have an organization like ICAP, because we have committees that are dedicated to promoting and furthering research to prove that these things exist, these things help, because unless you have the research, unless you have the peer-reviewed literature, you might not have people believe us, right? Believe that this actually works.
That's right.
So in medicine, even in dentistry, in many of our scientific sort of professions, you gotta show the research. If you don't
It's
have
true.
research, it doesn't exist, right? Yeah.
Yeah, I can kind of relate from that with that because my background is anthropology and sociology. I wrote so many research papers, and I had to do my citations, read a lot of medical peer-reviewed journal articles, research papers, in terms of because I can't just make up stuff, or make up stuff based on my emotions or what I think, right? Or what other people think. It actually has to be something, tested, whether in both like quantitative and qualitatively, right? In that realm. So yeah, it's so important for those research. I do have a question in regards to the, this international like ICAP, right? So like how many countries are we talking about so far?
Wow. Okay. Well, if you go on our website,
Yeah.
it probably will tell you
I
how
will
many.
share after our talk today with that. I'm going to do a separate post. So if you guys are
Sure.
wondering what the link is, I will share
Yeah,
that
but
after.
we have many different countries that where we have membership from all around the world. So
Wow.
and it increases regularly because we're
How often do you guys
still
meet?
a fledgling organization.
Yeah.
We started up in 2016, but yeah, I mean we do have ongoing conferences that bring people together so we can share this information. And yeah, it's I think for me it's all volunteer, right? No one's getting paid to be part of
That's
this.
amazing. Yeah.
And so this is where it comes from the heart. You really need to want to do this, to be part of this organization.
No, that's amazing because and this is why Jimmy's here with us today. Not because because he's a dentist, he's a man, and he's advocating for these causes that he volunteers for, and that many women and men, I think generally speaking, isn't really aware about. I wasn't, to be honest, I wasn't even quite aware about. I mean, I heard of it, but I don't know what it is exactly, and what the research behind it, and what the stats are. So yeah, and in talking about stats, Jimmy, can you tell us about the stats, regarding this? Yeah.
Well, I mean, the
Academy of like World Health Organization, yeah, about feeding.
I mean, so I mean, in the States, the American Academy of Pediatrics
Yeah.
Suggests feeding your baby only breast milk
Okay.
for 6 months. For the first 6 months, it's
Yeah.
that's the recommendation if that's possible. And what they do also recommend is that you supplement breast milk with solid foods until age 1. So essentially for a whole year,
Yeah.
first year of life, is breast milk. Okay, and then of course transition to solid foods. The World Health Organization goes further than that and recommends that you breastfeed along with eating solids until age 2 or beyond. So yeah, I mean, definitely, I have families that come in to see me. The mothers are telling me that yes, was able to breastfeed until age 3.
Wow.
And that's great. Now, of course, if you have families that have more than one child, right? So by the time child number 2 comes around, well, you're going to be able to still provide breast milk for the first child, who might be 4 or 5 or 6, right? So
Yeah.
eventually you can have a child that's being breastfed until their age 9 or 10.
Wow.
Not that common, but hey,
Yeah.
it's your choice, right?
Yeah.
You can decide what type of nutrition your child gets.
Oh.
So
Yeah.
yeah, so there's definitely benefits to breastfeeding, which is why again some women decide that they want to breastfeed even their older children as well.
Now this crosses another topic. There's also adult breastfeeding, because I hear women ask the question, can I breastfeed my child and my husband in this, but that's a whole nother talk.
I have no idea how that works, but okay.
Yeah, this is not part of ICAP.
I'll leave it to you to
Oh, I'm not an expert in this,
well,
so I wouldn't know. But I just now we're talking about like the age and the duration of
yes.
breastfeeding, right? So,
But
but yeah,
I think what's important, as per the World Health Organization, and the reason why they recommend that you try to breastfeed your child for as long as possible, is because of the health benefits, right?
yeah,
And so
which we're gonna talk about.
I think what they're saying, World Health Organization, is that if you can increase breastfeeding to universally, so like if every child is breastfed till at least age 1, or if not longer, that can be it's possible to save almost 800,000 lives every year,
Oh,
right? Because malnutrition still happens, even in this day and age, in other countries around the world. So if they're not able to breastfeed because of perhaps influences such that maybe they've been told that breastfeeding isn't as good as feeding other things like formula,
yeah,
or if they can't afford formula and they're told not to breastfeed, or they're feeding their children other things like soy or rice water,
yeah,
then you can have kids that are
malnutrition.
malnourished, right?
Yeah.
And that can result in
Yeah.
lives being lost that way.
Often hear like I think maybe more so in Asia, they seem to reach for formulas. Like I think my mom mentioned that actually when like early on, um, the doctors sometimes would say, "Oh, just go for formula or something," and that's kind of what the guidance from the nurses do as well. So instead of breastfeeding, they'll just buy the formula, right? So yeah, but
Yeah,
yeah, yeah. Sorry, you were gonna say.
there was a time that it was very prevalent that formula, it was in the hospitals. You would have free formula that's provided for at least a month for every baby that's born. And again, this is where there's a good, maybe at the time, back in the day when formula started to come out, it was touted as science's solution to creating super babies, essentially, having the most nutrition in in a bottle. And obviously that's being discredited, because that's not necessarily the case. But yeah, there's a lot of advertising, and still continues to be a lot of advertising, and perhaps misinformation about that. That's again a whole new topic, or different topic, that any lactation consultant, any
Yeah.
board certified lactation consultant can give you this skinny on that.
Yeah, yeah,
There's a lot of history.
100%.
Now, again, I want to underscore that formula can be essential when it comes to a child that isn't able to breastfeed. It's the next best thing to breast milk, right? So
Right.
we want to make sure that um, it's not basically discarded as an option there. But yeah, it's the pendulum has swung. That's swung back towards breastfeeding for sure in the
Um,
21st century.
so I think on the topic, the last hour on breastfeeding, I think maybe it's good to talk about what are the 10 great reasons to breastfeed your baby. I think you had shared some the from the government of Canada, and sharing 10 reasons to great reasons why one should feed your baby. And I think on our website it also says that it's up to 2 years, right? Kind of just along similar lines of WHO. And yeah, so I feel like I'm just gonna, I'll also be sharing this link too after our talk. And I think the top 10, it says for number 1, perfect nutrition. Number 2, protection. Number 3, brain power. Number 4, ready and portable. Number 5, size does not matter. I think that's what I had asked earlier already. 6, it's good for mothers too. Number 7, builds a special bond. Number 8, advantages continue as the baby grows. And number 9, good for the planet. Yes. And number 10, easy on the budget. Yeah. Feel free to jump in if you want.
No, that's so if you want, if you're going to provide the link, I think that's gonna be,
Yeah, I'm definitely gonna share this link. It's very important. Yeah. I think, just on the website, just very quickly looking, I think it perfect nutrition, they're talking about the perfect amount of protein, carbs, fats, vitamins, and minerals as the baby grows. In regards to protection, the website talks about how the breast milk can help your baby fight off sicknesses and diseases and that sort of things, right? So reducing like chances of your baby having diarrhea. I'm not a medical expert, I'm reading from the website. Legitimate information. Like reducing things like ear infections or lung infections, die of sudden death, infant death syndrome, overweight, or being obese when they're older. Oh, I didn't know there was a correlation to that. So breastfeeding has an impact on a person, whether they become overweight or obese when they get older. Okay, I did not know that, yeah. And then the website also goes over brain power. It shows that children who were breastfed actually scored higher on intelligence for IQ tests, and may even stay in school longer and earn more money as adults. That's a very interesting research. Ready, portable, size does not matter, good for mothers. I think this is an interesting one for women. Why is breastfeeding good for mothers? It says that the research shows that breastfeeding can protect mothers from many diseases such as breast and ovarian cancer, diabetes, and heart disease. Just I think it's good to clarify here very quickly. The body actually uses so much energy to make milk, right? So that's why I think from women, hearing from other women when they're breastfeeding, they tend to lose a lot of weight that is gained during pregnancy, right? So actually I've seen them become skinnier than pre-pregnancy. Yeah, so it's kind of interesting that way. It certainly does build a special bond, spending those time having the closeness and comfort of breastfeeding to bond with the baby. And so I think overall this is quite amazing. I think in keeping in mind of time, I think we went over time today, but very important, very interesting information and very, very good resources. I kind of want to ask, if you can tell us how can people reach your organization and how can other people help in this cause?
Well, I mean, our organization is a professional organization, so that if you are a healthcare provider who is interested in learning more about the issues with tethered oral tissues, tongue ties, lip ties that can affect, obviously, breastfeeding dyads, the mother and the child, but also how it can potentially affect future issues, right? So as we may have discussed, there are other, healthcare providers that are very interested in how they could help when it comes to speech impediments, whether we have issues with sleep or breathing, because again, sleep apnea can be a concern if your child isn't able to elevate their tongue up to the roof of their mouth, and because that simple sort of act of being able to touch the roof of your mouth with your tongue helps for expansion of the jaw. And if you have a wider jaw and expansion of the jaw, then you have more room for teeth to grow in. You have less need for orthodontics. The roof of the mouth essentially is the floor of the nose. So if you expand the mouth, your nose can also expand to a certain degree in the nasal cavity, and you have more capacity to breathe through your nose, right? And if you breathe through your nose, which is what we should all be doing, okay, as human beings, then you have less of a need to breathe through your mouth, okay? And breathing through our mouths is actually not ideal. We don't have the same filtration when it comes to of the air when you're breathing through your mouth.
Does the nose hairs?
You what's that?
Your nose hairs or something?
Oh, well, yeah, exactly. Yeah. That's the filtration. Yeah, it helps to warm up the air before it goes to the lungs, right?
Yeah.
So breathing through your mouth doesn't really provide for that. I mean,
You
you
know,
have to do that when you're exerting yourself, doing exercise and running.
you're,
To do both,
breath.
right? To both your nose and your mouth. But typically at rest and when we're normally, breathing, we should be breathing through our noses.
That's interesting because I recently, because I have sinusitis, I was experiencing allergies and whatnot kind of thing, right? So it's constantly congested. You were talking about your tongue, right? Like touching the roof of your tongue. I was watching something on YouTube by a doctor. I'm not sure, I forgot what kind of doctor he is, but he said to like raise your tongue and push to the top of your mouth, and somehow that helps to open up the cavities or here to help loosen your congestions in that area, right? So yeah, so it's very much 100% has to do with
when you think about where your tongue is when your mouth is closed and you're at rest, your tongue should be right behind the front teeth, right at the roof of the mouth, right where that little bump is, essentially behind your front teeth.
Yeah.
So that is the what we call the orofacial malfunctional therapist call it the spot. You should always keep your tongue where the spot is there. And when you're doing that, your mouth is closed and you're breathing through your nose. Yeah. So essentially, yeah. I mean, having the tongue touch, just the simple act of having your tongue touch the roof of your mouth, it can potentially allow for just a lifelong, normal breathing, essentially, because we have people who don't breathe very well through their noses. They have issues with getting oxygen. They have issues with sleep. And we could have people that will clench their teeth as a result of not being able to sleep well. And, again, lots of things that can potentially result because of a restricted tongue. So yeah, we have, all these other practitioners, such as the chiropractors that they can help with, improving mobility and again, it's all, interrelated. So the whole point is that with this organization that I'm a part of, we welcome all of these healthcare providers to share the information and learn from each other, and promote awareness. And I think that's the most important thing, is the awareness of this issue is going to be paramount, because otherwise it will never be acknowledged, right? This is going to be something that's, fringe, right? Because most people have never heard about tongue tie or lip tie. And if they did, they would have never have linked it to breastfeeding issues, right? From the beginning. And it starts from the beginning, having difficulties with breastfeeding, which unfortunately can span the entire, lifetime there for an individual. So if you know of anyone who's having problems with breastfeeding, please suggest that they find a knowledgeable lactation consultant to help with that, right? Because again, amazingly, there are not very many of them who are based in the hospital maternity wards,
right?
NICUs, yeah. So yeah, that's my PSA.
Yeah, no, that's a
public service announcement.
Which is so important, okay? Because regardless of whether one is going to breastfeed themselves or not, for everybody knows one person at least that is going to go through that experience or have gone through that experience, right? So it's absolutely very essential, important information for awareness and being to know where to access help or to get extra, further information so that you could share that information along, or you can utilize that information for yourself, right? And then, and that's really like what's important to me. Like, you don't have to be experiencing these things yourself or issues or challenges to be, spending the time to better understand it in depth, right? And then to be able to have knowledge or some sort of information to help other people, right? That's why I always say to people, right? Like, yeah, it's everybody's about human beings, So nothing is divorced from one another. We're all interconnected in so many different ways. Yeah. So Yeah. Jimmy, I want to thank you very much for your time, and thank you for bearing with me, your patience with the technical fail earlier, and thank you to my audience for enduring that together. It wasn't the worst. It's not the worst thing in life. It's just a technical fail. We were able to overcome that so that we can continue to share this very special topic full of very important information, so that every one of you can learn more and share that information and be able to access help, which I will be sharing the link after this talk. So thank you again, Jimmy. And I'm just gonna wrap this up. This brings this our live talks with Traei to an end. Again, my name is Traei Sai. I am the founder of Her Stories Untold. It's a global book project that we're essentially focused on sharing different empowering, inspiring stories of women from all walks of life around the globe. I also do live talks with Traei, which I have Jimmy here. Not just women, all genders are welcome to talk about very special things that all along is to, with the purpose to empower, uplift, and inspire other women or help other women, right? So that's very much appreciative of, sharing your time with us today. As well, Her Stories Untold is available on Spotify as well as Apple Podcasts, and coming soon to Amazon Podcasts as well. So please follow the Facebook page. Stay tuned. You can check back on our website too, which is www.herstoryuntold.com. And yeah, stay tuned. We'll have live talks on all topics. All topics are welcome. And you have a special journey, special story to share, or if you want to recommend someone, please feel free to reach out. So thank you very much, Jimmy, once again, and thank you to everybody.
Thank you, Traei, for having me.
Thank you so much. Take care, and everybody have a safe weekend. Stay tuned.
Merry Christmas.
Merry Christmas and happy holidays. Bye for now.
Bye.
Okay.